Hi, Dr. John here on this Facebook Live, covering some headlines over the last few days that you might have noticed in the news, getting behind those headlines a little in depth so that way you have a better understanding of not only what was meant by the headline, but what you can do for yourself and how that can help you survive the pandemic and make sure your family, your friends, your loved ones, and your community are doing much, much better. The things we're going to talk about. Number one, we're going to talk about the flu vaccine and why it's important, especially now with coronavirus being here and a possibility of having an increase over or throughout the winter. Number two, we're going to talk about masks and vaccines because that's been a big issue this week over a back and forth as to which one works better, which one we really need. And then the last one is going to be something called pandemic fatigue, which I think honestly we're probably all feeling, but in some places it's actually affecting the communities, affecting the countries, and so I'll explain why. But on top of that, when I'm through with this, I get to your questions. So if you have questions, please send them our way because they are fantastic questions for the most part. I love answering as many as I can, and hopefully those are the things that you really want to hear about. So we'll get to those after I get through the headlines. But first, let's start off with the flu. We are coming into our flu season. Our flu season typically happens November through March timeframe. But it can happen earlier, it can happen later. There's no real predictability as to when that happens. However, that means that you want to start getting your flu shot right now. We're mid-September, towards the end of September, hedging in that direction. You want to start getting them now. You definitely want to get them by the end of October. And most experts say by Halloween. So just think of it that way, that you and your family get your flu shots by Halloween. Recommendation this year is everybody 6 months and above get their vaccine. Typically, around 50% of the country gets their flu vaccination, but we're still having lots of deaths. On the average, 50,000 deaths or so from the flu every year, and that is considering that half the population is vaccinated against it. Now, the other criticism I've heard is the flu vaccine, well, if it's only 50 to 60% effective, it's not worth taking because it's not protecting me from getting the flu. That doesn't mean it's not worth getting, because even though it might not protect you from getting the flu, what it's really made for is to protect you from suffering consequences of the flu, to help make sure those complications don't show up, to help make sure that they're minimized if you do get the flu, to help minimize your chance of being hospitalized, and more importantly, to help lower your risk of dying from the flu. That's where it comes in. So don't think of its effectiveness in the point of not getting the flu because you had the flu shot, but think of it as hopefully you're not getting the flu. Again, that's around 50% effective at preventing that, but also at preventing you or helping prevent you from getting complications, hospitalizations, or deaths from the flu. But one of the main reasons I'm bringing it up is because of what some experts are calling a twindemic, meaning we're going to have the flu and coronavirus at the same time hitting here. The reason it's important you get the vaccine is community-wise, think of its importance because it's going to spare the hospitals from getting inundated with people with the flu like they typically do November, December, January timeframe, because they will probably be inundated with coronavirus. Think back to April, how hospitals got overwhelmed, intensive care units got overwhelmed, and that was just with coronavirus. The flu was waning at that point. It was reducing in intensity at that point. But imagine if the flu is coming up at a high peak, if coronavirus is coming up at a high peak, and our hospital system is getting overwhelmed because of that twindemic. On top of that, personally, it can protect you again from getting the flu, prevent, hopefully lower your risk of complications, hospitalizations, and deaths from the flu personally, and it can prevent you from spreading the flu to other people, especially people in your household. On top of that, also, there is that concern. It's very unlikely it could happen, but people could theoretically get the flu and coronavirus at the same time. And you can imagine if both those viruses are hitting you at the same time, it's going to take a severe toll on your body. Again, we don't think that's going to happen very much, but it possibly could happen. Plus, when you do get the flu, it does lower your immune system because it's fighting off the flu. It takes a few weeks to recover. Once you recover, and so it's optimum time for the coronavirus to move in if it happens to be around and you happen to get exposed to it. So those are all great reasons. But this year, the flu virus, they have pushed out more of the vaccinations than they've ever had in the past. This year they're saying close to 200,000 vaccinations. That's more than they even had back in 2009 during the H1N1 pandemic. And so they're anticipating a lot of people trying to get it, to the point where right now in some areas, especially we've heard in New York, the New York area, that there are shortages because so many people are trying to get it right now. So just make sure that, number one, you do get your flu shot. Now's a great time to get it. And that you plan ahead. So call ahead, because it's not going to be like regular where you can walk into a pharmacy, you can walk into your doctor's office and get a flu shot. Because of coronavirus, things are different. So call ahead to find out what their protocol is, how they want you to go through that, and how they want to make sure that you get that shot to keep yourself, your family, your loved ones, and your community healthy during the flu season. So that's the flu vaccine. Now, switching to masks versus the coronavirus vaccine, and you might have heard it this year or this last week. Dr. Robert Redfield, he is the director of the CDC, testified in front of Congress, and he said that masks are better than the vaccine, and he went on to say that masks will be better than the vaccine, even we assume that he was meaning even when the vaccine was here. Yesterday, I had a doc-to-doc conversation where I have a Facebook Live series called Doc to Doc, typically do it a Wednesday or Thursday, talk with Dr. Tom Frieden. He's the former director of the CDC. And I said, okay, what do you think he meant? What is meant by this, and where do you stand on this? And he said, here's the deal. What he probably meant is that masks are very effective at preventing coronavirus as long as we and everybody around us are using them. Vaccines could be very effective at preventing coronavirus as well. And it's comparing the two is almost equivalent to, his quote was comparing apples to theoretical oranges, because the apple being the mask, which you already have, the theoretical orange being the vaccine that theoretically we are going to get at some point here. And so he say that the comparison is almost a moot comparison looking at the two. But the bottom line is that as physicians, as public health experts are saying, on top of this, that vaccine is going to give us another tool in our toolbox. So we have the mask, we have the vaccine, we have some treatments. Those are all tools that we can use as physicians to prevent and treat coronavirus at this point. Now, as you know, there is no cure for coronavirus, and the fatality rate is still fairly high for people that get hospitalized, especially in the intensive care unit. But I think what Dr. Redfield was trying to say is these masks are very effective. If you wear them, they're very effective. We don't know what the vaccine effectiveness will be at this point. We think it'll be sufficient. We think it'll be high enough, but we don't know because the vaccines have not gone through phase 3 trial. And so I think the point he was trying to make is don't wait for the vaccine. Start using the masks right now because that can help you. And even when the vaccine is here, we're probably still going to have to use masks for a while because not everybody's going to be vaccinated initially. Now predictions are maybe by middle of the next summer, summer of 2021, we'll start getting the general population vaccinated because it's going to take a while to produce a vaccine, which hopefully we have by the end of the year, but probably more realistically beginning of next year. Start getting out to people in that phase 1 that the National Academy of Sciences came out with, which are those that are taking care of coronavirus patients, so the frontline healthcare workers, those that could have critical issues if they suffer coronavirus complications, and particularly the elderly, those with some severe pre-existing medical conditions. And then phase 2, 3, and 4 would filter down to the general population. That'll be longer. That'll take longer for that to happen. So again, what they're saying is, and the question I asked Dr. Tom Frieden, again, the former director of the CDC, on my Doc to Doc series, is which, basically, will any one of these, masks, social distancing, vaccine, treatments, any one of these stop the pandemic? And he said, absolutely, unequivocally, no. Neither one of these will stop the pandemic by themselves. You need a combination of all of them used in different ways. Plus, on top of this, we're going to have different vaccines for people because there'll be multiple companies making vaccines. And so the main point being that we need to use all these to keep us safe and to get this pandemic under control. So that's vaccines versus masks. And then the last news topic you might have heard about is something called pandemic fatigue. And that is essentially, we've been almost 8 months into this, and most of us are getting tired, admittedly same way, of putting on a mask every time I go outside, making sure that I stay away from other people, not being able to meet my friends out at the bar or restaurant, avoiding those situations. But we're doing it for a good reason. We're doing it because it is helping keep the pandemic under control. And what we're seeing is that in other areas where this is not happening, where that pandemic fatigue is hitting very hard, they're seeing a resurgence in cases. As a matter of fact, the best way to describe it is this is concerning here because we're seeing this happen here, but right now our cases are hovering around 40,000 a day. The hope is they can get under 10,000 a day before we say, okay, this first wave is getting under control, but they're still around 40,000 a day. But they're bad in other areas, particularly let's look at Europe. Spain right now, a few months ago, less than 500 cases a day. Now they're averaging around 10,000 cases a day. France, they're over 8,000 cases a day right now. That's a higher count per day than they had back in April when they were really having trouble struggling with this. Now, one thing of interest is there are hospitalizations and there are deaths, but there aren't as many hospitalizations as deaths as there were back in April. And they think part of that is because this pandemic fatigue and these increases in cases seem to be driven by young people that are getting out and getting together and gathering and then getting coronavirus, spreading it to each other and spreading it to others. The fact that they're young means that they're going to have less complications, less hospitalizations, less deaths. But that doesn't mean they're not going to have zero hospitalizations, zero complications, zero deaths. It means less. Plus, on top of that, they can spread it to the more vulnerable populations. Plus, if you want to look also, Israel is locking down for the second time. They have Rosh Hashanah coming up, but they're locking down for the second time because their coronavirus cases are going up as well. And just to give you some numbers here real quickly, if you look at the U.S., again, we're hovering around 40,000 a day. Looking here at Spain, last number, 11,291 a day. At one point, they were down to under 200 cases a day. France, we talked about, they were in the 500 range a day. Now they're much, much higher, 10,500 cases a day. And then Israel, again, if you look, 22 back in May, 21, 15 cases, May 17th. And now if you look at the cases, just the other day, they had 5,520. 5,238 yesterday. So you can see how these numbers are just skyrocketing in these areas. And you might say, okay, yeah, that's understandable, but they're smaller countries, so those numbers don't mean much compared to the U.S. Well, looking here at the U.S. and looking at Spain and France in particular, at the number of cases per million people. In Spain, 215 cases per million people. In France, 129. Here in the U.S., 117. So per population, Spain and France are doing worse than the U.S. right now. And we're not doing a fantastic job, but we're doing a better job. But we need to keep doing that. And that's why this pandemic fatigue news article is important, because the news headline is important, because we need to realize, number one, we have that. And number two, we need to keep it under control so we can keep the pandemic under control. So what can you do? Well, there's a variety of things. Number one, recognize you have pandemic fatigue. Talk to others around you, especially people outside your house who are your friends. I guarantee you they're probably suffering the exact same thing. And talk about things you're doing that are a little bit different. And then try to do things that are interesting and fun. Try and get fun face masks that you can wear from time to time, and you can just have those on there. I have a smiley face mask I'll show you here in a minute that is a great one to have because it just makes me feel good to put it on. And other people, I think, it makes them feel good as well. On top of that, we also have, it's a good time to go out and try and get some me time. Try and do things that will make you feel better. If you want to get a manicure or pedicure, if you want to get a haircut, if you want to go out and exercise, go on a lake, just make sure you do it appropriately, that it's socially distanced and you're doing things appropriately, because that can certainly help. And that can help you feel better about yourself. But the main point is just realize we have this pandemic fatigue and that we're all going through this. We just need to double down on our efforts, especially when this so-called second wave will start coming when the weather gets a little colder, we start moving inside. So again, the headlines, flu vaccine, it's important you start getting them now. Make sure you get them before Halloween. Masks versus vaccines. There's been some news over this last few days about which is better. It turns out that they're both needed, and it's hard to say which one's better because they both are very effective, or theoretically the vaccine could be very effective at helping us get through this, but masks we know now are. And pandemic fatigue. It's a real thing. We're all suffering it. And in some countries, Spain, France, Israel, it's showing issues there because they're having huge influxes, huge numbers of cases rising in those countries. So you want to be careful with that and try to get it under control. But now let me see if you have any questions.
Does the flu vaccine increase your risk of getting COVID?
So does the flu vaccine increase your risk of getting COVID? And I think here's the reason people ask that. So one of the reasons I talk about getting the vaccine right now and getting it before Halloween is because if you remember, I said flu typically is November through March. That's kind of our flu season. Sometimes it hits early November, sometimes it hits December, sometimes it doesn't hit till January or February. We just don't know, but you want to be protected. When you get a vaccine, flu vaccine being a good example, your immune system is basically building up antibodies for a couple of weeks. And so your immune system first gets activated when you get that vaccine because that's the vaccine's job. What it does is it tricks your body, tricks your immune system into thinking you have the flu in this case, so it can build up defenses against it. You don't have the flu, but you can build up defenses against it. And then if you do get the flu, it can start fighting back against that. And because of that, your immune system is being hyperactivated at that one point where it's trying to fight off the flu that's not really there, but it's building defenses so when it does show up. In that time period, some people think, okay, I'm feeling a little under the weather. I think my immune system isn't doing too well, so if I get coronavirus, I could get it worse than I would normally get it. No, that's not the way our immune system works. So your immune system is specifically trying to target this, but it's actually in high activation mode. So if you got coronavirus at that time, theoretically, it's going to even have a better chance of fighting it off because it's already in high activation mode trying to fight off what they think is the flu, which is the vaccine in that case. So no, the flu vaccine is not going to increase your chances of getting coronavirus, but it's also not going to increase your chances of not getting coronavirus. The flu vaccine has nothing to do with coronavirus itself, and so that we'll have to wait until we get the coronavirus vaccine. But in the meanwhile, of course, wearing masks, social distancing, washing your hands, opening windows, all those things that we know work.
Do flu shots or the flu, pneumonia, show or create false positive COVID-19 test results?
That's an interesting question. Do any of these vaccinations, flu shots, pneumonia, any of the vaccinations, do they cause false positive coronavirus test results? No. And the reason is because those test results, if you think, and I'm assuming we're talking about COVID-19 test results, the diagnostic test results, the ones that tell you whether you have an active infection, not antibody results, which come later to tell you if you had an infection in the past and you have antibodies now. But to answer that question, no, it won't affect your antibody testing. As far as your diagnostic testing and whether you have it now, there's two different kinds. There's a PCR test and an antigen test. Both of those are looking for specific proteins or specific RNA of the coronavirus itself. And so it's not going to cross-contaminate with any other vaccine you get. So no, you will not get any cross-contamination there in the testing process. If you get one shot, it will not increase or decrease your odds of having a bad reading on a coronavirus test. And so, but it was a great question.
Is it safe to have a handyman work in my home?
Is it safe to have a handyman work in your home? Well, and the reality is at some point, we've been in this 8+ months. At some point, you might need a handyman to come into your house. But the important thing is to make sure that it is done appropriately, and you're doing it with the 4 things in mind. Wear a mask. So you and the handyman should be wearing a mask, and particularly depending on what part of the house you're in. If you have a basement and you're upstairs, probably don't need to wear a mask while they're downstairs. But if you come in close contact, and we're not talking within 6 feet, even if you come on the same floor with each other, you should both be wearing masks. On top of that, wash your hands, watch your distance, make sure you get that 6-foot distance. And then windows is going to be particularly important. Open up windows, get that ventilation going through there, so that way the workers who are not part of your coronavirus circle aren't affecting you as much because you're diluting out the air, you're exchanging the air. But again, the important thing is to realize that they need to wear masks, you need to wear masks. The other thing to think about is they can certainly come in different entryways than you do. So if you're upstairs and you have an entryway downstairs, have them come in and out through downstairs, so you really don't come in contact with each other. On top of that, even if you don't have a door downstairs and you can open a window and they can come in and out through the window, that's perfectly fine. The main point is lower your chances of interactions. You're going to lower your risk of coronavirus, of getting it from each other. And again, doing those 4 W's: wearing a mask, watching your distance, washing your hands, especially if you go down there to talk to them about the work they're doing and you've touched door handles or other surfaces they might have touched. It's something to think about. Of course, if you do have a handyman over, one of the things you need to think about is what are you going to do if they need to go to the bathroom? How are you going to handle that? And so something to think about beforehand.
Can you still get the flu after you get a flu shot?
Can you still get the flu after you get a flu shot? And I get this question every year. And as a matter of fact, I'm going to push this into 2 different questions with 2 different answers. Number one, can you get the flu if you get the flu shot? Yes, you can, because the flu shot is typically about 50% effective. Sometimes it pushes up to 60 or 70%. We're elated if it's that effective. Sometimes it pushes down to 40% or so. But that effectiveness is based on you getting or not getting the flu. How well does it protect you from getting the flu? And experts I talked to last year said, we have done ourselves as public health experts a disservice in continuing to talk about the flu effectiveness, the flu vaccine effectiveness, as to you getting or not getting a vaccine, because its true purpose is to, one, hopefully prevent you from getting the virus, but on top of that, prevent you from getting complications, hospitalizations, or from dying from the flu virus. And so, yes, it's possible you could get the flu, even though you got the flu vaccine. But even if you get the flu, and people will tell you this typically, my symptoms were not as bad as they would have been if I'd had the flu. And this comes from people who have had the flu in the past, where they just feel completely wiped out, completely miserable for a week to 10 days. Whereas if they got the vaccine, the symptoms aren't as bad. Again, it can lower your risk of hospitalizations and deaths as well, and other complications. So the question was, so that's part of the question about, can you get the flu if you have the flu vaccine? And I'm sorry, what was the other part of the question? It was
Yeah, can you still get the flu after you get the flu shot?
Yeah, so can you still? So yeah, essentially, you still can get the flu after you get the flu shot. And I'm sorry, yeah, the other part of the question is the flu shot will not give you the flu, because the flu vaccine itself is an inactivated virus, or it's a cell-based virus that usually has parts of the virus in there, not the whole virus, and so there's no way you can get the flu from the flu vaccine because there's no full viral particles, or there's no full virus in there, just virus parts, again, trying to trick your immune system.
What can you do to strengthen your lungs when you have COVID-19?
So what can you do to strengthen your lungs when you have COVID-19? Well, believe it or not, one of the best things you can do to strengthen your lungs is just to try and rest and recover as best you can. You don't want to overexert yourself. You don't want to do things that are going to cause you to be breathing very heavy for very long periods of time, because that's going to be an issue. And so, the number one thing is to make sure that you do rest like you would with any kind of illness, that you do just keep things under control. But on top of that, if you do start having breathing problems, then that's certainly something that you want to make sure that that people pay attention to. And so, again, the main point is to say, okay, if I'm sick, just like I am with any other illness, then I want to go ahead and rest myself. But if you do start having complications, if you do start having breathing problems, then you definitely want to make sure that they are taken care of. So again, thank you for your questions. They've been fantastic. Looking at our headlines, flu vaccine, why you should get it. Again, hopefully it will prevent you from getting the flu itself. Doesn't always do that, but hopefully it will. But it should lower your risk of getting complications, hospitalizations, or deaths from the flu. Plus, we're having the twindemic, both flu and coronavirus here at the same time. So we want to do your part in making sure that we're not inundating our healthcare system with people who have the flu, because they need to be held in reserve for people who have coronavirus. Masks versus vaccines, it's been an issue of contention this week. Talking to experts, it's masks and vaccines. Both are needed. The vaccine will be here eventually and will help out, but it's not going to be the end all. None of these are. Each thing is one different tool in our toolbox that we can use to get this pandemic under control. And then pandemic fatigue, it's a real thing. It's one of those things that is showing up in Europe right now in particular, and they're having much, much higher cases and numbers of coronavirus cases there. And part of that is because people are not following those 4 W's: wear a mask, wash your hands, watch your distance, and when does open up distance. So, just again, double down on efforts. And one of the things I talked about is doing fun things. I just want to show you my mask in particular. So my smiley mask makes me feel better. And I think those things can help you get through this pandemic and realize, okay, these are things we need to do in order to make sure that we all get through this. We help our communities, our loved ones, our families, and all of us stay happy and stay healthy. I hope you have a great weekend.